Hello everyone, welcome back to the channel Microbial World. Today's topic is Candida infections, especially oral candidiasis and vaginal candidiasis. Candida species are yeast-like fungi, and the most common type that infects humans is Candida albicans. Other species includes Candida glabrata, Candida tropicalis, and Candida krusei. Now here's something interesting. Candida normally lives in our body as part of the normal flora. They are present in the mouth, intestines, vagina, and even on our skin. Most of the time they do not cause any problem. But when the body's defenses go down or conditions in the body favor its overgrowth, this fungus becomes opportunistic and causes an infection called candidiasis or moniliasis. Oral candidiasis, which is commonly called as thrush. It is the fungal infection in the mouth caused by Candida species, usually Candida albicans. Risk factors. Infants and elderly are more prone to the disease because their immune system is either not fully developed or weakened. Immunosuppression, that is, people who have weakened immunity, such as HIV or AIDS patients, cancer patients on chemotherapy, or organ transplant recipients taking immunosuppressive drugs. Diabetes mellitus is another factor because high blood sugar favors fungal growth. People who are taking antibiotics or steroids can also get the infection because antibiotics kills protective bacteria and steroids suppress immunity, both of which can help Candida to multiply. People who have dentures or poor oral hygiene. The moisture and food debris under the dentures also provides a good environment for Candida. Types of oral candidiasis. Pseudomembranous candidiasis or thrush. This is the most common type. You can see white creamy plaques on the tongue, inside the cheeks, or on the roof of the mouth. If you wipe these white patches with gauze, they come off easily, leaving a red, raw, bleeding surface underneath. Erythematous candidiasis. In erythematous candidiasis, instead of the white patches, the mucosa looks red and inflamed. It is painful and may cause burning, especially when eating spicy food. Hyperplastic or chronic candidiasis. This is a rare type. In hyperplastic candidiasis, the white patches are thicker and cannot be scraped off. It is usually seen in long-term immunocompromised patients. Symptoms of oral candidiasis. As we already said, white patches or creamy plaques in the mouth, burning sensation or soreness, difficulty in swallowing in severe cases, loss of taste or unpleasant taste. Diagnosis. Diagnosis is usually clinical by looking at the lesions. For confirmation, a KOH mound of oral scrapings can be done. This shows budding yeast cells with pseudohyphae. Culture on sabrodextrose agar also helps in identification. Treatment. For mild cases, topical antifungals like nystatin suspension or clotrimazole iosenges can be used. For severe or recurrent cases, oral antifungals such as fluconazole or itraconazole is used. It is also important to correct underlying causes like controlling diabetes, improving oral hygiene, and stopping unnecessary antibiotics. Vaginal candidiasis, also called vulvovaginal candidiasis or yeast infection. It is a common fungal infection of the female genital tract caused mainly by Candida albicans. It is the excessive growth of yeast in the vagina that results in irritation. Now, who is at risk of getting this infection? Pregnant women, because high estrogen levels during pregnancy favors fungal growth. Diabetes mellitus, as we already know, high blood sugar also favors the growth of Candida. Immunosuppression, that is, women who are having weak immunity due to HIV, steroid therapy, or chemotherapy, women who are taking antibiotics because antibiotics reduces protective lactobacilli in the vagina, thus providing space for candida to overgrow. Tight clothing and poor ventilation. This is because excessive moisture and warmth also provides a good environment for the growth of yeast. Symptoms of vaginal candidiasis. Severe itching in the vulva and vagina, that is pruritus, which often worsens at night. Thick white curd-like discharge, which is often described as looking like cottage cheese. Redness, swelling and burning sensation of vulva and vagina. Pain during urination called dysuria or pain during intercourse which is called dyspareunia. Diagnosis. Doctors often diagnose based on symptoms and examination. Vaginal swab under microscope with KOH preparation shows budding yeast and pseudo-hyphae. One important clue is vaginal pH. In Candida infection, the pH is usually normal, which is less than or equal to 4.5. This helps to distinguish it from bacterial vaginosis, where pH is usually higher. Culture on sabrodextrose agar can also confirm the species. Treatment. Topical antifungals include creams or pessaries like clotrimazole or miconazole inserted into the vagina. Oral antifungals include a single dose of fluconazole, which is very effective in many cases. It is also important to bring changes in lifestyle like wearing loose breathable cotton clothes, avoiding synthetic or tight underwear, and also controlling blood sugar in diabetics. Complications of Candida infections. In some women, the infection keeps coming back. If it happens 4 or more times in a year, it is called recurrent vulvovaginal candidiasis. This needs longer treatment. In immunocompromised patients, Candida can spread beyond mouth or vagina and result in systemic infections like esophageal candidiasis, urinary tract infection, or even bloodstream infection called candidemia, which is life-threatening. So in today's lesson, we learned that oral candidiasis shows up as white plaques in the mouth with soreness and burning. Vaginal candidiasis presents with itching, redness and thick white discharge. Both are caused by Candida albicans and both can be treated effectively with antifungal medications. Thank you for watching.